I want to introduce our next speaker this is wonderful how it ties in to the previous presentation. Did you guys plan this? I mean, you did. Okay, well how it ties into the previous presentation is absolutely amazing and wonderful. And so for this presentation, it's updates on the gut-brain connection by our speaker, Christine Rosche. And Christine's background is she is a master's in public health, a certified nutrition specialist, board certified nutrition specialist, and certified, I have to translate all these initials after, certified biofeedback therapist with 25 years experience in the healthcare field. She developed and taught courses at Stanford University Medical Center and Heart Disease Prevention Program. Christine is the author of 2 books, the latest, Light Living, an Integrative Approach to Health and Weight. She has maintained a private practice in Palo Alto since 1980 and specializes in functional testing and integrative approaches for digestive issues, including GERD, malabsorption issues, gut permeability, IBS, IBD, constipation, and inflammatory bowel disease. As a licensed heart math trainer, Christine is pioneering the integration of heart rate variability biofeedback training with custom nutrition and gut healing protocols. Please help me giving a warm welcome to Christine.
So I know that many of you have heard that all disease begins in the gut. This is the core area, and it was such a pleasure to hear you speak earlier about all of the components of that. And so I'd like to start by giving you a little bit of background. I was working with many clients who were having at the same time, depression, lots of different brain fog, poor memory, inability to focus. And we're trying all kinds of approaches, and we're not able to really get a resolve in that. And so what is very commonly found, what I found, is that people who had brain symptoms also had a lot of different gut symptoms. And what I'm excited about is that now Time Magazine and the New York Times just this last month featured the gut-brain. Absolutely, it's now gone mainstream. It's exploding, like you were saying before, about the whole thing of that when people have depression and fatigue and all these drugs who are no longer working, oftentimes they have an overgrowth of bad bacteria in the gut, and they also have gut permeability, and many people have SIBO, small intestinal bacterial overgrowth, and a host of many things. So as we know, but it is the first time the last couple of years, and especially this year, that the mainstream New York Times said it is now proven that the gut does play a fact in a really major role in that. So I'm just going to highlight some of the studies that showed that, when you have all these patients with anxiety, most of the time they also had colitis, inflammatory bowel disease, celiac, all of those different diseases related to every person having anxiety and depression at the same time, and some type of component of that. And autism, we've already heard about. There's so much in the journals about autism being correlated with abnormal digestion, and certainly gluten intolerance, and very serious issues in terms of malabsorption and deficiencies. And I work with quite a few physicians in the community and also chiropractors who have reported, that when they take the child off of gluten and dairy, even just that simple step without many other things happening is already such a big change in the behavior. There was one child that couldn't speak, that had major issues with speech, and once they went off the gluten and the offending foods, they started to talk again normally. So it was really exciting. And I see a lot of people with a host of different things. They're usually referred to me by internists or GI doctors, and they've been on many drugs. For example, one client I saw recently had been to 5 Stanford GI doctors, had had heartburn and bloating and gas, probably for 10 years, was on 4 different medications and had not had any resolution to that. And so I'm going to be talking a little bit later about case examples from my practice and what I've been doing with people with heartburn, with constipation, with very severe digestive issues, and the types of protocols I'm using that have had very good results with people. So the most exciting thing that has just come out, and of course we already heard a little bit about this earlier, is that I had people also, with MS, with lupus, with Hashimoto's thyroiditis, and it turns out that activating the vagus nerve, which is such an important part of the parasympathetic system, the immune system and inflammation can really be affected. And so as a biofeedback practitioner, I was very interested in that, especially heart math and heart rate variability testing and so on. So basically the brain, again, influencing inflammation, it's just really profound, and also inflammation, high blood pressure, and so on. So here's just a picture of the vagus nerve, how vagus nerve stimulation reduces metabolic inflammation. And it's so important to know that this is something that, if you go into the medical literature or you're working with physicians, it is mentioned quite a bit. But the part of the vagus nerve reading the gut microbiome, it turns out that when it basically initiates a response to modulate the inflammation based on whether you have bad bacteria or good bacteria, or the level of bacteria in the gut. So this is very exciting because I use a lot of different testing companies. I find that the doctor's data testing has worked best for my clients, and also it's the most economical one. And the vagus nerve will initiate that response to basically the organisms, which many people have pathogenic organisms in the gut without even knowing that they have it. So the test that I do, I always say to people, why, guess when you can test. And what I have in my practice is almost everyone, many people say, I feel great, they feel fantastic, that they have a bacteria that's overgrowing and they're deficient in the very bacteria that they need to have their immune system and their body function properly. And so what I found, for example, is with skin, we've now heard of the brain-gut axis. There's the brain, also the gut-skin axis now, which shows that people with acne and all skin disorders have overgrowth of bad bacteria, missing crucial bacteria, and this is now studied across the board. So there's actually different conditions through this mechanism have been associated with deficiencies like lupus, MS, all the autoimmune disorders, Alzheimer's, dementia has been associated with changes in the bacteria, that they're actually overgrowing certain bugs in the gut, and many of them have gut permeability, but also are deficient in others. So when you re-inoculate, for example, there was a study when you re-inoculate with a fecal transplant, you can actually completely change the mental status of that person. They get different bacteria, and their gene expression is different. So it's very exciting because you can upregulate or downregulate inflammation and gene expression based on the gut microbiome. Trillions of bacteria that are in the gut, and it's made up, of 10 times as many as our cells. I mean, it's just incredible. So the vagus nerve, the vagal tone is measured by tracking your heart rate along with your breathing rate. So your heart rate speeds up a little when you breathe in and slows down when you breathe out. So the bigger the difference is between your inhalation heart rate and your exhalation heart rate, the higher your vagal tone. Higher vagal tone means that your body can relax faster after stress. And it improves the function of many body systems, causing better blood sugar regulation, reduced risk of stroke, and amazingly enough, your digestive system works much better. And that vagal tone is also associated with better mood. So the higher vagal tone, your mood would be better, and much less anxiety and more resilience. So another way to measure vagal tone is through heart math devices. So heart math, I work in my office with heart rate variability analysis, which looks like a little bit like that. It's a graph that shows you have a sensor on your ear, and you're connected to a computer and a screen that shows you what your response is, the space between your heartbeats. How fast is your heart responding or how slow to each breath? And so basically, all autoimmune, autoinflammatory have that correlation with the higher the heart rate variability, the more resilient you are, and the lower it is, the less resilient, and the more there were issues around the health conditions. So more health conditions, less resilience. And so you can easily measure that. So if people are interested in that, I can talk to you about that later, how to measure it. So how do we increase vagal tone? I thought that would be very interesting for all of you. Slow rhythmic breathing, especially in the diaphragm, and breathing from your belly. Most of us know how important and healthy it is to breathe from your belly and then breathe to the top of the lungs. But humming and singing is something also that basically you hum a song and you feel better, right? When you start singing or you say the word Om, can actually shift your vagal tone quite a bit also. Washing your face with cold water stimulates the vagus nerve, and loving kindness. So a lot of what we do in heart math is we focus on the breath and we focus on breathing in a feeling of appreciation and kindness to yourself and others. And that really changes the heart rate variability as well as the response of your body. So you can really affect this whole system, and it balances the gut microbiome. I have a lot of clients who have SIBO, small intestinal bacterial overgrowth, and they've been on so many medications. Medications only made it much more complicated. Sometimes it helped short term, and they're on different probiotics and so on. But the key that I find is when I use the customized testing, to see the level of the SIBO, which is a breath test, and then the next step is that there's customized probiotics for particularly what they're dealing with, combined with the heart rate variability training through the heart math, is what is now producing amazing results with people feeling so much better with SIBO and having better post-tests in terms of what's going on. So I find you have to work with increasing vagal tone, looking at testing for the bacteria, exactly seeing what kind of bacterial overgrowth, what's the imbalance, what's there, and then also working together with the appropriate nutrition. Because one of the things, by the way, that has been known is that food itself, if you take the food currently and the toxins and the pesticides and the glyphosates, actually all destroy the gut bacteria and have really affected it. So we're really not discussing that a lot, how the increase in pesticides and toxins, along with many other factors, have now influenced and have actually affected people's microbiome. Very significant. So I work a lot with people on what to do in their home, how to get rid of toxic products, what to use for their laundry, cosmetics, everything around us now, and Roundup is everywhere. You can't avoid it. Even if you're living a really healthy lifestyle, you're exposed to glyphosates, which damage the gut microbiome. So this is all very important. So basically, the gut microbiome, which is like an organ in itself, is inhabited by 100 trillion microorganisms, 10 times the number of cells in the human body, and also 75% of the immunity is in the gut, and most of the neurotransmitters are made in the gut. So that's why you were saying before that antidepressants don't work, because the issue is really here. It's not so much that the serotonin is produced in the gut, and if we don't take care of what's needed to produce that, then we can put a drug for a while, and then most of my clients say, I don't feel the drug's working anymore, right? It works for some time, and it's because of this mechanism. So the microbiome weighs 2 to 6 pounds, modulates and is responsible for the vitamin mineral absorption and digestion, and produces anti-tumor and anti-inflammatory cytokines. Every time when I do a stool test with my clients, the comprehensive stool analysis, I show them exactly what their level of inflammation is. How are they absorbing their nutrients? So the digestive test shows digestion, absorption, exactly what their enzymes are needed. And then also what's going on with inflammation. It will show early stage inflammation years before it will show up on any kind of a standard medical test. So since I grew up in Europe, what I really love is the kind of testing. Some of you may have heard Dr. T talk about the M2PK test in Germany. So there's a test where your poop is shipped to Germany. He's always laughing with us about that. And it is one of the most conclusive tests, the M2PK, for colon cancer. So I work with Dr. T also with people who really want to just do the colon cancer test. That's one area. And so it's very important, looking at all these different things, pathogens, we mentioned all of that already. So here's just an example of the neural connections activating the, again, the vagus nerve, the gut microbiome, and what happens, and how it affects all the organs in the body. This is very, very important. And so the gut pathology, we all know that about depressive disorders, but autoimmune in every case. I've worked with a lot of clients who have autoimmune with the antibodies who have been through standard treatment and have not had any kind of, they're coming to my office saying, I really want to get better with this autoimmune disorder. And so the key is to assess what's going on first and to test. And so Steve is going to pass around, for those of you that are interested in learning more about the gut test that I do and how I can help you identify, he'll pass around and you can just put your name and email on that informational sheet. So it's so interesting too that when you take the mice, they had all these studies with mice who received fecal transplants and had very different responses under stress with the right type of bacteria for the gut than they did when, they were just having the bad bacteria. So that was really important. So the newest information is that leaky gut and the microbiome affects not just, we thought of the joints maybe and the brain, of course, but it's affecting, thyroid, Hashimoto's, autoimmunity, rheumatoid arthritis, frequent colds, and a lot of brain issues. And one of the things I found from many clients is that they have said, now that I'm on the right probiotic, I'm not getting sick in the winter anymore. I have a pilot group of 50 school teachers who would get sick every winter, at least 1 to 5 colds. And we did the gut test, and they've been taking a combination of supplements. I have discovered some newer, very exciting soil-based probiotics that are, that I customize based on what your gut test shows, and they're not getting sick anymore. They're exposed all day long, so we know it's the environment. So leaky gut, of course, is depression, inflammation, it's major. So I'm just going to show you a little movie here of a healthy gut. This is from Genova Lab, and what happens, and Dr. Smith was already, mentioning some of this in terms of these different aspects. And so the junctions are tight, so the molecules are still pretty much contained. And then the next one is the leaky gut movie, and you can see what happens when there's the spaces between the junctions in the intestine, and all of this goes into the bloodstream, which he was saying, you're the bloodstream, the audience. So this is a really good example of that. And he's talked a lot about gluten, so I'm not going to go into it as much. Thank you for bringing that out. But I also, when I lecture, talk quite a bit. And it's interesting, I'm from Europe, and when I go to Europe, I can eat gluten because the grain has not been altered to the extent as here. So I have all these clients, they go to Europe, they lose weight, they eat the grain, they're fine. And here, it's pretty serious what's happened. So the symptoms we know about. I'm not going to spend that much time because I want to spend more time on the cases, but I have a lot of clients who have autoimmune because of the gluten sensitivity, could eat it until the GMO version of the gluten came out. So it's the hybrid gluten. I actually have a friend, a doctor from Europe. When she travels, she brings her bread in her suitcase with her because she said to me, I've got to have my bread. I can't eat a single piece of bread in the United States. I took her to all these stores, and So it is really what has happened to our food supply. And I do want to say that in 25 years of practice, I have never seen the amount of autoimmune disorders that I'm seeing now and the amount of skin and reactions to the food. So it is, I think it's a combination. It is the food we eat. Of course, it's also the vagus nerve and how we live our lives and the emotional part. But I think a lot of it is the toxicity that has increased so much that one of my mentors actually said, kids that are born in 1990 and 2000 will not outlive their parents, because she was talking about also the EMFs. It turns out that cell towers do influence our gut microbiome. In Germany, there's a lot of well-kept secret studies out that yes, indeed, stress affects us, frequencies affect us. So if we hold our cell phone all day long, to our ear, and and we're near cell towers, and we eat non-organic food, even if we eat organic food, and so many of my clients drink tap water and everything, it does affect the microbiome, and we're basically having an assault on what would be a natural way to have, in terms of how microbiome would be very healthy under the conditions if we didn't have this constant environmental toxicity. So the brain inflammation is a real concern. So there's 12 different aspects of wheat and similar grains, and basically this will impact GABA, serotonin, dopamine, and plays a major role in ADD, depression, autism, Asperger's, all of the learning. And it's not just in the gut. So, as we heard in the previous lecture, it extends out of the gut. So basically it's systemic. So once you have, people say to me, oh, I'm eating gluten, it's just inflamed here, right? No, it really moves, even if your gut isn't permeable, it's just extending into every cell of your body that's inflamed. So we talk about what if you had inflammation in every cell, what would that be like? So depression, all the studies show, proinflammatory, the gut injury, zonulin goes systemic, which is what happens, a byproduct when you eat the gluten and you have the tight junction injury, and it opens up the barriers. So basically when you have an overgrowth like SIBO and you have low hydrochloric acid, parasite, I see a lot of people have fungal infections, candida, parasites that have accumulated for a long time. So they have a lot of brain fog, fatigue, issues like that come from many years of having these, bacteria in their bodies, the fungus, and then the weed. So the zonulin, gliadin activates the zonulin signaling, and then that affects the genetic expression of what happens with the gut barrier. So Crohn's disease, diabetes, MS, asthma, inflammatory bowel, all are related to zonulin basically regulates the intestinal barrier. So it has to do with that, leaky gut syndrome again, and how then all of the catecholamine, dopamine, serotonin, bell curve, high serotonin, low, is all linked with this impact of the gut junctions in leaky gut. And GABA, and they found actually that the Lactobacillus rhamnosus is the one that really supports, reduces anxiety via GABA. So if you have certain bacteria, that's what I'm doing now with a lot of my clients who have anxiety. I see a lot of people with that. We assess what's going on with your gut, and we test and then work with specific customized brands of probiotics. It's not enough just to go and get a bottle for $5 billion, at a health food store, because first of all, you don't know what's in the bottle. So what I've done, I use products and I work with customized manufacturers that you do independent assay testing, not the lab. And I don't make money. I'm not working for a particular lab. I'm going to use only their probiotics. So broad spectrum probiotics. Usually, certain probiotics, produce certain neurotransmitters. So Lactobacillus and bifidus produce the GABA, acetylcholine. You can see all the different areas that are needed, the different bacteria that's needed to produce different neurotransmitters. So I use, for most people, for a lot of people, I use 100 billion up to 250 billion or more for a while, then retest and really customize what they're doing, what kind of probiotic they need for what time. So it's a very finely customized process. And most of you know that the bottom line is when you are born, whether you're born C-section or vaginal delivery, is the absolute foundation for your microbiome. This is the foundation that when a baby passes through the birth canal and touches the mom and does breastfeeding, that's what is meant to be. And they've done so much study that with the C-sections, and most of my colleagues and friends, they had one C-section, they were kind of told you have to have another. And especially if the baby's in incubator and the mother can't breastfeed for some reason, it starts to disrupt that pattern, and those are then the predispositions for asthma, allergies, and all of the childhood diseases, because what happens is that the first month and the first week of life is the most critical in developing the microbiome that we need for the rest of our lives. So it doesn't mean, if you've been C-section and you haven't been breastfed, that you cannot catch up, but it takes a lot more attention, and many of these children and adults that I've seen have never, it says here, never been able to catch up with that later because they were not connected with the right. So a fecal sample of 98 Swedish infants over the first year of life found a connection between the development of the gut microbiome and the way he or she was delivered. And there was a major difference in this, and stress hormones cause leaky gut. Antibiotics have increased childhood obesity by 50%. And so we need to know that it's really important that it's not just antibiotics that we're given. I mean, the key is, yes, they save our lives, but so many times they're being given when they're not necessary. And most drugs are implicated in leaky gut. So what causes leaky gut is, not just the American diet, but it's pharmaceuticals. If you're taking, even for some of my clients, taking over-the-counter Advil has affected the gut lining. So it's important to know it's not just heavy pharmaceuticals. If you've been on one dose of antibiotics, you need to take a probiotic right away for at least 3 months to be able to catch up and make up the damage that's done by certain drugs. And most of my clients are on 4 or 5 drugs, so their gut flora is completely wiped out, and they've also, a lot of them have leaky gut. And glyphosate has now been highly correlated with autism. So the Roundup, and at today's rate, 2025, 1 in 2 children will be autistic due to the agricultural practices that we have here. And also GMO corn causes tumors. So what's different now, before I go into case studies, is I just want to mention that it's not just the white flour, white sugar, by the way, but all the bugs on the digestive test, I do love refined carbohydrates. So the sugars, sugar in fruit, sugar in alcohol, white flour, white sugar really feeds all those bacteria and bugs that are the bad bacteria. But we have more toxins, we've got more C-sections, too many medications, and the amalgam fillings, and then the poor methylators with the epigenetics. So you can see in the graph the tremendous increase in Crohn's disease, MS, autoimmune. I mean, as I said, it's like triple, quadruple. And what's happening is all of this is correlated with a combination of the environmental factors and the toxins with the person's genome, the genetic predisposition with their microbiome. So basically, if the gut microbiome is really out of balance, it will affect all of the genetic predisposition also in that way. Glyphosate destroys the pathway that makes it turns out the latest study shows that the Roundup actually destroys your body's ability to make the neurotransmitters you need. So this is very serious, and I encourage people to get politically active. I don't want to get involved in this talk, but just to say that it's much more serious because it is everywhere. I've talked to a lot of physicians in integrative medicine and saying, you can do everything right and you're still surrounded by it. So, and basically we need the B vitamins, we need all these things in order to preserve our brain. And so I'm not going to go into case examples. I think I have about 10 minutes. Is that correct? And then I'll have a few minutes for questions. Yeah. So I've seen quite a few people. Here's an example of a woman I've seen with chronic inflammatory bowel disease, but young women with ulcerative colitis and have been on steroids, prednisone, hydrocortisone. Here are some of the readings of their data. This woman is, call her AG, and She also was on a poor diet. And what I want to show you is this is an example of a doctor's data test measuring inflammation. So what this is here is the lysozyme. See, the lysozyme is the enzyme secreted at the site of inflammation, should be 600 or less. It is 912, and the lactoferrin also. Lactoferrin is actually a specific marker for inflammatory bowel disease and many white blood cells. But this is kind of a typical ulcerative colitis client where she had been on 4 steroids, she'd been on all these drugs for many years. She was getting to the point where she said, I'm tired of drugs because I never feel better. I mean, this was year after year. Her Sig-A in this case is normal, but I also measure secretory IgA, and of course it's upregulated many times with food sensitivities, leaky gut. It's downregulated also in many people. So here's an example of what the stool test would show, which is her expected beneficial flora right over here. I haven't used this, I think it's this over here.
Shine on the screen there.
Excuse me?
Shine on that screen.
Okay, yeah, so see this over here? So you can see she's got a 0. NG means no growth. So she has a 0 lactobacillus, and she's got a good bifidus, but she's got a 1 of this one, and she has an overgrowth. Even though it says commensal, the main thing is that she has Klebsiella pneumoniae here, which is implicated in a lot of joint conditions. Alpha hemolytic strep, and gamma is not to be ignored. Even though it's in the middle, it could be in the dysbiotic, but it's really important to work with that. So this is just an example. She also had, some Candida albicans, and then these are her short-chain fatty acids, which again are really out of balance here. The fermentation of fibers, and she has red blood cells and so on in her digestion markers. So what I did first of all was, the first step was she was still on a lot of medications, was to give her an elimination diet. So she removed the gluten and the white flour, white sugar, but she also started taking L-glutamine, which is a real gut healing fuel for the cells of the gut. And daily food symptom diary, and including some of the probiotics, aloe vera. I mean, I'm using now also a lot of Apex products, At nighttime, I have people, work with a gut repair product that they take when they go to bed. Every product I use is customized based on the testing. I don't use just one brand, I use many, many different brands. But I found that with the people that were so inflamed, like when she included the aloe vera in different forms, she also worked with someone like Dr. Smith with the food sensitivities, added fiber. She had been eating primarily a standard American diet. So she started adding some of the foods that really supported her. In 3 months, she was off of prednisone. She was still on a drug, but I had quite a few other people when she did so well. The GI doctor said, okay, the people that don't tolerate the steroids, I'm just going to send them over to you. So what's been incredible is she was told for the rest of your life you have to be on steroids. You will not have children. She will never travel. She said, I cannot function. I can't think. I cannot live my life. I'm unable to even think about having a family. So in 6 months, she was off all meds by following the nutrition plan with the heart math, stress reduction, customized probiotics, and many gut healing. So it wasn't just, I'll show you a few of the other ones I used. It was just the glutamine and the aloe vera. She said she felt great, and she was traveling and planning a family. And every year, she still calls me and says, guess what? My child is now 4 years old. It's never come back. I feel fantastic. And so why I do what I do is because I see so many people with inflammation in every area of the body, autoimmune, joint diseases, but these young women with really serious inflammatory bowel disease, ulcerative colitis, their diet was just never, they've never been even told about what's going on with their nutrition, with their gut microbiome. I think the biggest key is that we tested for the good bugs, the bad bugs, and customized everything to them, so that they really were able to heal. This is a woman, again, acne, anxiety, panic attacks every day, blood in the stool. She had been on many different drugs also, and in her case, what I want to show you over here is this. She has a dysbiotic flora, and this is what you want to look for. This is what I and working with so many people is, it's not just she had a 0 lacto, 2 bifidus, sort of okay, but the lacto is so critical for making anti-inflammatory factors and helping her to absorb her foods. So basically she's got this, but this is the key here, Klebsiella at a 3+ is a pathogenic dysbiotic flora that is implicated in research with serious inflammatory disorders. So she knew, I don't want to go down the road and get rheumatoid arthritis. So this is usually what I do is I work with a number of medical specialists, but the good news is, look at this. This is the follow-up tests. We did natural the natural antimicrobials. We did not use antibiotics. The physician said, well, if she has that overgrowth, maybe give her more. No, she wanted to go into natural antimicrobials like grapefruit seed extract, oregano, plantains, black walnut. This is actually what's so exciting is when most people, not only does this pick up over here by giving the right probiotic, but the dysbiosis is gone. I've got about 100 clients who've done this test who had 6 months, a year later, and then the year after that, the dysbiosis is gone, and they recolonize to a 4+, which is really what we want to see. So here's just some of the inflammatory. One of the things that helped her a lot was the heart math training. And also, I'm using some other things here. So what I'm going to do is to say to you that it's amazing because the acne cleared up 50%, but a year later, the acne was almost completely gone. So probiotics have to be strain-specific, species-specific. They help us with manufacturing and absorbing our vitamins, minerals, everything. And I think the future is that we're going to be able to go to a place and actually purchase the right bacteria and probiotic microbial for a particular condition that we have. So customizing it is what's going to happen. So you have any condition, like these clients who are no longer getting colds, they're on a specific soil-based probiotic that has made all the difference. And so here's the repair supplements. I used a lot of this with the people that I was talking about and with my clients. And not one fits all at all. In other words, some people do great on the glutamine and aloe vera. Others really need much more in depth, like some of these quercetin and gamma oryzanol. So I have different products, like Repair Vite by Apex is excellent for that. And the most important thing is their state of, yes, I want to commit to getting off the standard American diet, and I'm going to stop drinking tap water, because every day when I drink tap water, I'm saturating myself with toxins, So many of my clients drink tap water all the time, and right now it's like you're ingesting, chemicals all day long. So again, repair, I do a lot of SIBO repair. Probiotic, the prebiotics are so critical. I don't have time to go into it. I could do that at a later seminar, but it's much more for people who don't have SIBO, small intestinal bacterial overgrowth. The prebiotics are key. So one of the things I just want to say is also genetically modified food really interfere with your ability to maintain a healthy gut microbiome. So what do you need to do to maintain it? Work with the vagal tone. Remember what I was saying. The breath exercises, yoga, heart math, biofeedback, taking time out for yourself increases your vagal tone, number one. The stress reduction and being aware and testing your gut, which this went around, and I'm happy to. I have a card here, and I also have something else that I want to show you around the testing. And then focus on organic, farmers market, non-GMO food, and really clean water. And then you work on, then you do your test, and you re-inoculate with the bacteria your body needs, and you can use natural products and antimicrobials to release the bacteria that you don't need. And basically no refined white flour, white sugar, it really makes a big difference, because most of the women I'm seeing are on antidepressants, and antidepressants will kill off the microbiome, and then you're back to what can I do to renew that. So I want to offer all of you half of a comprehensive digestive stool analysis, and what you can do is at my website, digestivehealth.center, there's a link. As long as you go there in the next 2 days, you click on the link and you will get a visit with me to determine what gut test is right for you, and then I'll give you this special offer, and then I'll customize your probiotics for your unique body type. So thank you very much. I want to take a few minutes for questions now. See?
And that was an excellent presentation. Let's give Dr. Christine. And I'm going to we're going to open up to questions for up until 10:02. We do have to be out of here at 10, so after we wrap up with questions, we want to start heading out. But anyway, one thing I just want to comment on, you're saying using up to like 100 billion. I'm going up to Sagan dosages. You know, Carl Sagan, billions and trillions. Yes, I'm finding actually that by going, I titrate up because people have to get used to it. But yeah, I'm finding the best results when I'm going up into the 400 to 900 billion range. When you think, people may say, oh, is that a problem? Well, when you've got between 100 and 400 trillion, actually, with the current research, that many microbes in your gut, then that's still spitting in the ocean when you're going up to 900 billion. So anyway.
That's a really good point. I just want to follow that from Dr. Cousins to say that, to just actually say that I find that with a lot of people, though, when you go too high, especially the SIBO folks and all that, I have to start very slow with most people with severe dysbiosis. Yes. It can take 6 months, then they can go to the trillion, but you have to really carefully titrate. So, any other questions? Anything else? Yes.
So I may have missed it in the initial part of your case, but when you were going through the pre-test and then the post-test, did you mention that you had used antimicrobials as well, or were you using specifically?
Yes.
Okay.
I do want to, I'm so short on time here, but what I want to mention here to answer your question is that in order to get rid of Klebsiella pneumoniae, which is a really tough dysbiotic flora, I have had to use many rounds, usually 2 or more antimicrobials. And what's great about doctors' data, the assay testing tells me exactly with their particular Klebsiella response to which antimicrobial. So I've got an assay that says plantanis and Uberursi, or oregano, and I use those, and sometimes I have to use them on and off for a whole year to get rid of a lot of people I see with rheumatoid arthritis have 4 of those dysbiotic flora growing, and I need to stop that for a while, work with other therapies, and then go back to the antimicrobials. It's very hard to eradicate in that way. Yes, SIBO is the same, and as a matter of fact, the APEX people, as you know, have a whole SIBO protocol, but I found that actually the drug, I went to a 3-day SIBO conference with hundreds of physicians, and the conclusion was, boy, this is so tough because the drug often is needed in combination, and then when the drug doesn't work, then you put the antimicrobials. So with the SIBO, I have found the vagus nerve stimulation right now with the heart math, and the biofeedback to be the most effective for lasting results, because the SIBO people have real difficulty with staying oftentimes on what the higher doses it needs, and the drug makes them feel terrible, and then they want to stop the drug. So it can be a vicious cycle with SIBO, but that really seems to help. So, okay, anything else?
Thank you for the informative talk. Is the heart math program you showed one of their newer ones, or will people with a several-year-old machine be able to run it?
You can run it also with the old machine. What I encourage you to do, if you're interested in doing the test, you can actually look at, I'll show you which machines. I've used all the different types of machines. I mean, there's a lot of new things out in HeartMath. So you can actually, you can call me and we can talk about what you have now and what your goal is and things. But I do a 6-week HeartMath biofeedback training, which is really effective for the microbiome. So you can actually use this if you're interested in wanting to do the HeartMath. You don't want to do the gut test, you can call me or just sign up on the website, and I'm happy to do an introduction to HeartMath because it's been incredible to see the responses with the microbiome with HeartMath. Yes.
I have a quantum biofeedback, and it has a program for activating, it's stimulating the vagus nerve.
What is the name of the program?
Quantum biofeedback.
Okay. Oh, yes, the
Skio?
Skio. Yes,
Yes.
I have a Skio, so I know exactly what you're
Does it
talking about.
work? I've done it. I've been feeling better from stress and anxiety.
Yeah, that's
It's
a
to point-
longer, it's a very good question. You can come up to me afterwards because I've used the Skio for 10 years, and there's a big difference between the HeartMath results and the Skio results because it works totally different principles. Heart rate variability is known all over in terms of the vagus nerve and the shift in the microbiome and the chemistry. The Skio is more a energetic assessment and energetic treatment, completely different modalities. So it would not do the same thing, but I'm happy to talk to you about it. Yeah. Okay.
Okay.
Yeah.
With that, thank you very much, Christine.
Yeah.